LeBron James' son Bronny was admitted to the ICU after suffering cardiac arrest last week. He's now home. It happened while working out at the University of Southern California. It caught a lot of people off guard since he's a young top athlete. Looks can be deceiving, but more than 350,000 people a year will experience cardiac arrest, some of them children. Here to talk about adolescent heart health and when there's cause for concern is Dr. Joshua Quinones with the Modern Heart and Vascular Institute. Good morning.
Good morning.
All right, so anytime a young top athlete, something like this happens, it really catches our attention. It is rare, but it does happen. But there's a difference between what we know more commonly as a heart attack and cardiac arrest.
Yes, ma'am. So a heart attack would be a blockage of a coronary artery that would limit oxygen to a part of the heart muscle. More commonly, we see this in adults. Cardiac arrest would be when the heart itself, more globally, isn't functioning properly. And there are several causes for that.
Yeah, is there usually any warning signs of that? Because I know people are like, what do we look for?
Absolutely. Lightheadedness, dizziness, chest pain, heart palpitations can all be precursors to an event like this, but sometimes it just presents itself with loss of consciousness.
Yeah, but especially if we have an athlete, this is the reason why it's important to get things like that checked. When should someone think about seeing a pediatric cardiologist?
Anytime they have concern about their kids' cardiac health, if they have cardiac symptoms or new things like murmurs, or even chronic disorders like hypertension or high cholesterol, I would see.
Yeah, all right. A lot of kids, the reason why they're having heart issues at all is because it's congenital, meaning it came with birth, right? Is that always diagnosed at birth, or are there times when somebody may miss it?
It can be missed. Sometimes we'll find it in adolescence or even in adulthood. There are varying degrees. Some are more minor, more severe, but it can be missed.
Yeah, but with today's technology, it's like as long as you know, there are a lot of things that can be done.
Absolutely, yes. There are a lot of interventions, medications, and as long as you're getting routine physicals and following up with a pediatrician, I think that would be the best course of action.
Who should get that routine physical? Obviously adults. I know at Modern Heart and Vascular Institute, you all take care of all kinds of heart issues with adults as well. But for a child, when should a physical start for them, if at all? I guess if there's a family history, is that?
Yes, ma'am. If there's a strong family history of cardiac abnormalities, it should prompt cardiac investigation, or if they're having the symptoms of chest pain, palpitations.
Yeah, all right. I know there's a lot of parents right now whose kids are in sports, and when they heard that story about Bronny James, they're like, uh-oh, maybe my child should not play sports. Okay, let's be realistic about it. In perspective, cardiac arrest in kids, like I mentioned earlier, is something rare, but what do you say to kind of arrest some of those fears and at the same time be vigilant?
Yes, so the good news is that a lot of kids, or the vast majority of kids, can play sports without any issues whatsoever. Mm-hmm. It is those aforementioned kids with either congenital heart disease, strong family histories, or the athletes that are having chest pain, palpitations that should seek further cardiac investigation.
All right. Modern Heart is also active in the community in a number of ways. Dr. Quinones, you are at Timber Creek Elementary School. What are you taking part in there?
It was an event where we were just trying to educate the community about heart health. I'm particularly excited about preventative medicine. I think that living a healthy lifestyle and taking steps to prevent bad things is better than a reactionary approach.
Yeah, when you say preventative lifestyle, because as we know, the number one killer of men and women around the world is heart disease.
Yes,
but
ma'am.
If you take those preventative steps, that could drop drastically.
Absolutely, we're trying to take steps to help decrease that.
All right, thank you very much. Modern Heart and Vascular Institute is now seeing patients of all ages, kids, parents, grandparents, great-grandparents if you got them. To book an appointment with a board-certified cardiologist, visit them online at modernheartandvascular.com or give them a call at this number. It's 832-644-8930. Again, that's 832-644-8930. Appointments fill up fast, so contact them today. Modern Heart has locations throughout the greater Houston area, including their newest location in Tomball. By the way, they have doctors who are fluent in Spanish as well.